Dearly redheaded, we are choosing consciousness today to get through this thing called grief. Interesting word, grief. It means love, which makes for a mighty good joke. But I'm here to tell you, there's nothing else. Just joy. And if the big picture tends to bring you down, go crazy once your life goes. Woo!
I'm still here with Dr. Bob Stein. We're talking about dementia and Alzheimer's. Bob, you made reference to the memory testing, the traditional memory test that my mom experienced a handful of times before I disallowed it, if that's such a... She would be asked... and I was told by the doctors it was to establish a baseline. She had already been diagnosed, but she would be asked a few words. I remember it was like boat, the color red, something else. Then be able to talk about other things with the doctor, and the doctor would come back and say, do you remember the words we started this conversation with? And she couldn't.
Right.
And I hated that test. I ended up, in the end, fighting for that kind of stuff not to be done, which created problems that I've explained before on this podcast. I don't want to bore you with it. I understand
Sure.
that doctors needed it to get insurance, and please, the powers that be. But what is the strategy? I mean, what is the strategy with establishing that baseline? Is it really just for insurance? Or is there some people that miraculously it shows some sort of comeback or a consistent decline, which I guess is more, the decline is obviously the more important.
Yeah, it's going to show a consistent decline. It's really for kind of academic interest only. And yeah, you could say it's for insurance to kind of prove with numbers that this is a dementing condition. And that delayed memory test with interference, where you tell them to remember 3 words, you do another task, that's the interference task, and then moments later, and we're talking about maybe 3 minutes later,
Yep.
you're asked to repeat those words again. That is a test that's fairly sensitive to dementia.
Yep.
Without dementia, most people will get at least 2 of those words, but with it, they won't. So. Yeah, there's going to be the rare patient that improves on that test over time. It's probably not going to be an Alzheimer's patient, though. It's going to be someone who had something else. Some of these multi-infarct dementias where it's related to a stroke type activity, there can be some recovery after that, because the whole nature of stroke, you can have at least partial recovery after those events. So that's a different presentation.
I noticed, and I think I asked you about this when we talked privately, and I don't think it made it onto the last episode. I noticed it was like the progression was like a downward staircase. There'd be a decline and then a plateau, a decline and then a plateau.
And you can have... it's a misnomer, but they call it spontaneous recovery. You can have a lucid day,
right,
where you say, "Hey, well, this is encouraging," but then it's quite discouraging when kind of things return back to where they were. So yeah, it's not a straight line down, like you said. There are plateaus. There may even be a little bit of upturn.
Yes,
on a good day, and then you have the issue. And I don't know if your mother experienced sundowning or not.
Yes.
Did she? Yeah, you have that. Where in the evening, things kind of deteriorate somewhat.
Yeah, and you reminded me of something that's important to mention. I remember a handful of years before she passed, she had stepped into the supermarket and didn't know where she was, and I thought that was like the beginning of the end, and she did come back from that. And I would always do things... my goal was always to relieve her brain first and mine second. So what I would say to caregivers is, know thy patient. For my mother, the huge whiteboards had 2 huge whiteboards.
Okay. Yeah.
That I would put things on. And I even handled when she lost her sister. She mourned and grieved the loss of her sister, and I wanted her to be able to do that because she always wanted the truth from me, always wanted the truth. So I put it on a whiteboard, and it took her about 2 weeks she grieved and she mourned and she was sad. And 2 weeks in, the memory became that she felt her sister had died a few years prior. And then I took it off the whiteboard because that's the memory that remained.
Yeah. Yeah.
I would do a lot to keep her in the 40s. I wouldn't let her be tested for those cognitive tests and created a ruckus, but she would be asked questions. Thank you for laughing.
Well, you know why it's kind of silly, not for what you did, but for doctors to give you a hard time over that. While testing is nice for numbers and all that, behavioral observation in the end is really the most important functional assessment anyway. So if a person refuses testing, even from the get-go, all right, you're going to be able to diagnose dementias without the numbers. You don't have to have the numbers. As an example, did your mom ever undergo the Vineland Adaptive Behavior Scale testing?
Not that I'm familiar.
Okay. I mean, that's just a checklist. It's not even a test. It's just a checklist. And it's used to place people with intellectual disabilities, like in group homes and things like that. Because with the Vineland...
What, spell that word?
Vineland, Vineland, named after
Vineland. Got it.
Yeah, named after Vineland, New Jersey.
Got it.
Where there was a famous institution for people with mental disabilities. Traditionally, IQ under 70, you have an intellectual disability, what used to be called mental retardation, and you can get services based on that IQ. But nowadays, they still want that IQ number. But what they really want is that Vineland number, because the Vineland is the checklist of adaptive behavior. In other words, functional daily behavior. Your ability to walk and talk and count money and have conversations with people, read a newspaper, use the scissors. And it's a checklist of like 300 different items. Can you do this? Can you not do this? Can you do this a little bit? Can you not do it well? Whatever. And you can ask the individual about these things. You usually want to ask a caregiver or a parent if it's a young person, or a teacher if they're in school. And that's how you do a pretty accurate assessment of where they are. I guess my point in saying all that is that they really never needed testing anyway to diagnose and monitor your mom.
Yeah, most of the doctors were fine with it. I want to segue from here into another conversation we had about, hang on a second, I got to do one at a time. The problem came, and I've discussed it without you on the podcast before, was hospice. Hospice kind of has this actuarial 6-month thing.
Right. Yeah.
And I figured all this out going through it. Nobody had to tell me. I kind of figured out how they, I'm a business person. It wasn't rocket science. And numbers are my thing. So after the 6-month mark, because mom could tell an intricate dick joke from the 40s, one of the nurses got it in her head. Maybe she didn't have Alzheimer's. And
that's she's just off. Yeah.
And so mom would be cheery. She'd repeat these jokes. She had a litany of them, and that made her feel like she was having a conversation because she couldn't have a conversation. So That is what That is where we went. We went with these handful of obscene jokes, and 90% of the people who walked towards in the door would ask her to tell the jokes. In the case of this woman, she didn't find it funny, cute, whatever. So long convoluted story short, Mom ended up getting kicked out of hospice because I wouldn't let them cognitively test her. And I didn't understand why the level of her decline, her heart condition, and other things didn't supersede Alzheimer's. But in hospice, whatever they put first is what, that's what they have to consistently prove. So I really didn't understand the goal at the time, but because hospice was really the main thing they were helping with was bathing, I let it go because it ended up, I didn't need it. I didn't need it till the end. And then in the end, they didn't want to show up because they wanted a director to come. They had an appointment to come. She was dying. They were set to be there like 24 hours before she left the earth, I believe. And I got the call that they weren't coming because it was me and I had made a stink. They wanted a director to come with. And I said, she'll be dead. And she was.
Well, there's the outpatient in home, and then there's the inpatient hospice. In my experience with both my parents, outpatient hospice, they even want the, 6 months to live type of thing. And inpatient hospice, they don't want people there more than a few weeks.
Yeah, there was a lot of misinformation, and
hospice has nothing to do with your diagnosis. It has everything to do with how long you're going to live.
I agree, but they will also see now I'm talking out my what, but in my case, I was encouraged to get them involved for other types of things that they did that were well within, like there's a sales pitch involved in hospice. I'm sorry. And maybe that has something to do with number of patients, how many people they have to keep in their employ. So I don't want to talk about it like it's the case everywhere, but there was definitely some motive to get her onto hospice when death wasn't imminent. And that became part of the problem because she exceeded the 6 months, if that makes sense.
Well, yes. And the 6 months I know is not etched in stone, even though it's a kind of a
barometer
line there. And people are discharged from hospice and then they come back. And you especially see that with certain types of cancer, because of, the advances in cancer treatment. People that, doctors sincerely believes they only have less than 6 months, but they continue with cancer treatments, and they have some recovery. Now, the whole, hospice, their model of care is palliative, which generally means that, you're just going to kind of crank up the painkillers and keep the person comfortable, and the active treatment for the condition is no longer present. And I'm talking about cancer, all right? But there's always exceptions to the rule with those things.
Yeah, and I had someone, and I've mentioned it before, her main aide, her experience had been with a patient who had given a large donation to hospice. So that was what I was going off of, and it ended up being fine. I just ended up, doing what was mom when she would be quizzed historically would look at me for the answer, and they would tell me that I couldn't answer. And I was like, I can't do this to my mother. So I didn't. And I'm pretty, when it comes to the brain, I just less is more, I think, sometimes. And
yeah.
The other thing I had told you was years before her passing, I had gotten information on large doses of vitamin E, 2,000. I don't remember if it's IUs or milligrams or how vitamin E is measured, but it was 2,000 units. I made like a potion. She'd gone to a neurologist. The neurologist wanted to put her on a med that essentially saved, in the way I interpreted it. I'm not trying to put words in someone else's mouth. What they were trying to save the left brain, the task-oriented side, and I was like comfortable with that going. I was comfortable with the right side, music and movies and all that stuff. And I told you I made this potion. It was high E, coconut oil. I had a few other things, all based on research and conversation with doctors, and we went for it. We didn't know if it was going to do anything for the plaques, but we did it for quite some time. Whether it staved off Alzheimer's, I don't know. All I can tell you is we had a pretty decent experience where that was concerned. But you made an interesting comment to me, again, when we were talking privately, not on the podcast, that I wasn't salvaging the right over the left. You said essentially I was salvaging the whole brain.
Yeah, you really can't separate out that this is going to target the right and this is going to target the left. It is whole brain. And from research going back to Carl Ashley, and we're talking about early 20th century, he found with all the various, mice and rat studies they did back then, that a lot of it had to do with percentage of brain that you had remaining. Now, in these little animal studies, the cutoff for Dr. Lashley was like 20%. After 20% loss, you saw various deficits. Before that, you didn't. That doesn't extrapolate too well to humans because, as we talked about, you can lose a third of your brain just through aging and still function quite well. However, another person that has that same third of their brain gone is not functioning well at all. And so it's not clear yet why some people that have all that brain loss are doing okay and some people that have similar brain loss are not. So there's a lot of stuff to figure out yet, but brain loss just in and of itself is not automatically related to impairment. With Alzheimer's, you have those plaques that just destroy large amounts of brain tissue in addition to just sort of mere shrinkage over time with age.
Yeah, and I will say we stopped. I stopped that potion, for lack of a better word, when she had a spontaneous brain bleed.
Oh, okay.
She had a spontaneous brain. For a while, they were trying to tell me my mother fell, and I was 99% sure she hadn't. And I found out it could be spontaneous, and that's what caused me to just say, all right, she was, well into her 90s and advanced, and it just any benefit that was derived, I was comfortable with, where we were headed because
right.
She had a really, really a good life. But interesting enough, and this is when she had the brain bleed, the EMTs were not going to take her to the hospital, and I knew she was off. And I said, "Ma, tell me a dick joke from the 40s," and she couldn't.
Oh.
And that's what put us in the hospital, and that's what made them able to detect the bleed.
Yeah. Yeah.
So those dick jokes came in handy a number of times.
Well, and there's an example where you had enough knowledge of her to do an assessment that no doctor could do.
Yeah.
Unless they knew her really well.
And that in the one situation, I think it was the brain bleed. The neurologist came in, had a number of residents behind him, and he started with the cognitively cruel questioning. Jackie, where are you?
Right.
I said, why do you do that? He goes, I have to establish a baseline. And me being me said, ask her a dick joke. And to his credit, he looked at her, asked her to tell a joke. She did. And I said, there's your baseline. You know,
Yeah.
I just was like, I just didn't understand, you know, in my mathematical mind, a baseline is something that, you know, you can show deviation from once you're far gone. But anyway, just,
Well, and you knew what her baseline was.
yeah, I mean,
Whereas the doctors know what a sort of generic baseline is. Yours was much more specific to your mother and therefore much more valid.
right. And I'm trying to share with our listeners that stuff becomes important as caregivers because, Mom watched The Sting her last couple of months of life every day. The Sting was what regulated her. And that's what kept everybody sane. I mean, in one sense,
Yeah.
I don't ever want to see it again.
Right. Of course.
But
yeah.
in another sense, it became, as long as that movie was on, we got as much function out of her as we could. And I did the same thing with music. Just, it was a lot of, I used to call it the 51st dates experience.
Sure. Yeah. That's right.
Okay. Now I want to ask you just, questions that are more spitball oriented. Have you found from either your patients or from stories from caregivers of people with dementia having increased intuitive or spiritual experiences?
I have not had that experience.
Are you aware that it's not uncommon?
I've certainly heard about it more in stories from others,
Okay.
but not personally with patients of mine or caregivers that I've seen. I mean, the person to ask those questions would be people that work in memory care units, where they see large numbers of people every single day, and they're probably going to tell you stories about things like that.
Yeah. And I have, I'm a fan of, I don't think I've mentioned it to you. I've mentioned it on the podcast 65 times. Maya Bialek, she's a neuroscientist. And,
Oh yeah. She was in that show. Well,
yes.
What show?
Well, a few, but probably Big Bang is probably.
Yeah. Right.
Yeah. She has, in her podcast called Breakdown with her boyfriend, Jonathan Cohen, just want to make sure, it's the two of them. They have made it, their mission to, explore where science meets spirituality. So they are talking a lot about this kind of stuff. And I'm very intuitive, and I have claircognizance, and I have some other abilities that I'm still coming into because the more I process my trauma, the more I'm able that the intuition comes in, and there's sort of a hand-in-hand thing with that. The other thing that I brought up with you, I don't know if we talked about it in the podcast, but I remember bringing it up personally, is the impact of long-term, especially in women, I can't speak to men, although I'm sure it affects men, of long-term dissociation on the brain and leading towards dementia. Do you have any comments there?
We had talked about dissociation as
My favorite word, Bob. I can't help it.
Well, dissociation as a skill that can enable adaptation in extreme situations.
Right.
And I think the example I gave you was concentration camp victims who were able to dissociate their way through that experience so that they could separate the horror they saw around them, kind of put that on the shelf for a while by just being somewhere else mentally, So in that way, dissociation is a powerful survival mechanism.
Right. For
Now,
all,
right. But where it becomes sort of degrading to the mind is if it becomes maladaptive and then kind of rears its head year after year after year because of emotional triggers. So I guess the best example of this is someone who's subjected to chronic abuse,
yes,
where
or intermittent.
yeah, I mean we've all known people where, and maybe you experienced this, where they're talking to someone and that person innocently raises their hand and the other person cowers in fear, okay, because of prior episodes where the person who raised their hand was about to hit them. All right, and maybe that's a simplistic example, but it's a conditioned emotional response, and that's what PTSD is. It's
Right.
conditioned emotional responding. So, but if you're in a situation where due to abusive experiences, you now have a lot of triggers, or things that shouldn't ordinarily cause those responses do cause those responses, then you're putting yourself in a state of chronic stress when, objectively you shouldn't need to. And that sends in this cascade of detrimental things that happen to the body. Body-wide inflammation, immune system dysfunction, you just get sick more often, your body is open to infection and whatnot, because you're not adapting. You're maladapting. You're not adapting in a healthy way to life, exposed to too many triggers. So, yes, dissociation is a gift, but it can also be a curse. Yeah.
So, and again, I just dog with a bone. So, do you believe, or have you read any of the research that long-term dissociation can be a contributory factor to dementia?
When you look at the laundry list of things that are contributory factors to dementia, social isolation pops up as one of the big ones.
Mm-hmm.
And when you look at, well, what causes social isolation?
Right.
PTSD causes social isolation.
Bingo, bingo, bingo. Okay, so all right. So we're talking about it without talking about it.
We're talking about events. All right. When I interview combat veterans for PTSD issues, one of the biggest concerns is social avoidance. They don't want to get into fights with people. They don't want to have to storm out of gatherings or whatever. But they do not want to be around crowds of people. They don't want to be in restaurants. They don't want to be at parties or celebrations. They don't want to be in nightclubs. They want life to be calm and quiet, and to be either by themselves or maybe one or two other people in their lives that they trust. And while that is calming for day to day, it generates long-term social isolation, which is quite unhealthy.
Thank you for listening and supporting Natural Born Redhead. If you follow the bouncing balls, please like and subscribe. If you know someone interested in sparing others grief and inciting joy, message me on Facebook or reach out via my website, Natural Born Redhead. J-Ma.